is Kathy Madsen, and I support a health services research project at the Uniformed Services University where we are using big data to look systemically at systemic overuse, low-value care in the military health system. And I've heard a lot of discussion today about patient and provider interactions as a driver of keeping those low. I've heard a couple mentions of big data. How would you go about moving from for instance, Johns Hopkins did the 19 indicator procedures that if you see these, you're probably seeing greater overuse. How would you move from that to the bedside?
Let me give you an example. I'm thinking specifically about cancer screening in people towards the end of life. So there are very specific guidelines about what age is the recommended time to stop cancer screening. For women, for men, breast cancer, colonoscopy. Oftentimes, physicians do order these as a matter of sort of a knee-jerk reaction. We just continue because we don't think about it. So again, it would be very useful to have more systemic reminders, for example, on the electronic. I mean, people would kill me for saying that because nobody wants any more reminders on the electronic health records. But that would be something that would be useful to prevent low-value care. Even a reminder to have the conversation. I'm not suggesting that, oh, the person is 75 years old, you cannot even order the mammogram, because some 75-year-olds should have a mammogram. But at least a reminder to have that conversation based on guidelines. And of course, as it was already mentioned, we need to really look specifically at each person and their priorities and quality of life issues.